I'm Brady and I'm 16 years old. So my diagnosis is Pectus Excavatum, and I started noticing it around like 10 years old when I started hitting puberty. So my chest on the outside was it was almost like a bowl.
As time went on, we realized that it put pressure on his lungs and affected the way that he was breathing. And that led to him needing an inhaler for sports and one thing after another.
It's just gotten bigger and bigger as I grow and muscles form around it and stuff like that. And for me, it's bigger than most people, so it affected my breathing as well. So that made it extra difficult for soccer.
It was something that we didn't really realize was as big of an impact as it was.
We got to the point where the pediatrician said, if you want to speak to somebody at Children's, now is the time. And this was probably when he was 14 years old.
I'm the researcher, and you just want to know every little detail about it. And when you start to see that it's something that a lot of people do surgery for, I think that kind of makes you a little bit nervous.
And we did some research, heard amazing things about Dr. Kenney.
I'm Brian Kenney. I'm a pediatric surgeon here at Nationwide Children's Hospital. Such a privilege to work at Nationwide Children's Hospital because we have a lot of support to do the care that we think is best for kids.
He was one of those doctors that formed a connection with you before the surgery, and that was just so helpful.
Well, surgery day, you're very nervous going to Children's that morning.
I think you go into it, you just want the best for your child, but we know that we're also getting closer to getting through this.
So there's been a number of advances over the last few decades. We do this minimally invasively, meaning we have little tiny incisions to put a camera into the chest and pass the bar under the sternum. And that procedure basically uses a metal bar put across the chest, and that pushes the sternum out.
10 years ago, when we were doing this procedure, most patients stayed in the hospital for a week. In the last 5 years, we introduced the use of cryotherapy, and that is essentially a freezing of the nerves at each level of the ribs. Then within 24 hours, the nerve is essentially numb.
By freezing it, it doesn't completely destroy them. It just makes them not work for a period of several months, which is a perfect time for patients to recover from this surgery. We've taken a procedure that used to be an inpatient stay of a week or more and months of pain to most patients go home the next day.
He looked different immediately. The second we saw him, we could see his chest looked completely normal.
You could just tell that he was excited. I think there is that little bit of an adjustment to this is my new body, and it's exciting, but it's also different.
With the Pectus surgery, it allows you to do a surgery that you know is going to be a big change for a patient, and that's going to last them for the rest of their lives.
I can breathe so much better. It's actually crazy.
He could tell instantly the second he was able to get back on the soccer field, which it took about 3 months of recovery. The second he started running again, he could tell that his breathing was so much easier.
You're more comfortable in your skin as well, and that's the most important thing, to be confident in yourself.
Ultimately, I really want him to be happy. I really enjoy, the next 2 years of high school and what's to come.